early stages of hip mobility exercises. Sometimes some people can get anterior hip pain or hip impingement. They make the rotation of the hip joint feels just that little bit harder. So today we're going to go through maybe 3 exercises to improve your rotation of the hips, so improving the mobility of the hip joints as well. We like to talk about anatomy, don't we?
I love to talk about anatomy.
So the hip joint is a ball socket joint. Essentially, one sits across the femur and the pelvic bone. So the hip can come into internal external rotation. So this hip is a little bit limited because it's got screwed on. But if we want to assess that, the hip, when we're doing shin inwards towards the body, that's an external rotation. And I'll go inwards, and that's an internal rotation. So both of these movements are just as important. And there is actually a way that we can test our own internal external rotation and lying, I guess.
Yeah.
So we can have a look at that, and then we'll go through the 3 exercises that we're going to give you today. Oh! Goodness.
Careful with that.
Sam, do you mind lying on your belly for me?
Of course.
So what I need you to do is to bend your knees. So this is just a quick test. It's not one of, there's many ways you can test internal and external rotation, but this is just a quick way to look at it. So the main thing for here, I need you to make sure your hips are level and pressed on the floor, and then you're just going to drop that out and see how far you can go without the hip coming, and then you can measure that if you want. So just take a picture and draw a line and measure the angle, and then you can look at the other side too, without that hip coming out. Nice. And you're going to do the same on the other side, so you're going to drop that. Most people, you'll find you have one side that's bendier than another. That is quite normal. So can you try and keep it 90 degrees? So you're going to drop it out.
Which is more helpful if you have a mirror.
Yes, because you know how it feels, or like someone giving you some feedback, and then the other way. And then that will give you an indication of whether you have one leg that's like stiffer than the other in terms of the rotation of the joints. Lovely. So we're going to give you an exercise. Ideally, if you have a band, that would be great, because that band will give you a bit of feedback. And I found that it really helps with activating the glute more.
Definitely.
More. So the muscle that comes here. So the first exercise we're going to do is the clamshell. So all you need to do is lie on your side, and you're going to put the band just underneath your knees, so around the shin area, like parallel. There's different levels of this exercise. So the easiest level to start with is keeping your feet on the floor and just rotating the top leg towards the ceiling. And you can do this 8 to 12 times or so. And the resistant band will make it a lot harder, because you really need to work against the resistance to create that opening of that hip. Lovely. Can you do that working?
I can definitely.
Next one I'd like you to do, you will need a wall. So you're going to lay on your back, and you're going to place your feet on the wall. And you're going to lie on your back. Nice. So we're going to do an exercise called bend, lean, forward, out. Do you want to think for your head?
Yes, please. Come on. Thank you.
Just something there. Okay. So what I'll actually do is pressing that hip into the floor, and actually trying to get that ribcage sucked in as well, so you're activating the core. And you're just going to bring your knees open. So again, you're working on that external rotation of that hip, and bringing it back in. So repeat this a few times so you know what it looks like. And you might find that one side will tend to drop more than the other. In your case, it's the left one
Goes a lot further.
quite a bit further than the right one in terms of the strength and the control. Well, we know what to work on then.
We know what to work on.
Lovely. And if you want to make it harder, you can bring your feet closer to the floor, or even completely off the floor, and just have your 2 toes in like a diamond shape. And then you can practice the same exercise, dropping it out, but that will require quite a bit more core control, because you might find that it takes a bit more work to work on the stabilizing muscles. Lovely. Okay, the last exercise we're going to show you is an external rotation isometric exercise. We're going to use the wall again still, but you probably don't need the band. You're going to take the band out. You're going to have one feet on the wall, and then the other feet on behind that knee, so in that external rotation position. What I'll actually do now is have one hand against that knee, and then you're going to press that knee into your hands and you're going to hold it for 5, 4, 3, 2, 1, and then you're going to relax. And then you can repeat that a few times. So you're going to press into your hands. So you're working on that, kind of getting that inward strength. 5, 4, 3,
Oh, for me,
2,
sorry.
1. We'll do it one more time. That's not sneezing. When you're ready, you're going to pull it in. 5, 4, 3, 2, 1. Lovely. So that is the main 3 exercises that we're going to give you today for some hip mobility drills. I hope you find it helpful, and bless you, by the way.
Thank you.
Yeah, and we'll hopefully make more videos like this.